Hi, my name is Antonio Kupech, and I'll be performing primary and secondary assessment with history as well. So right now I'm assessing the scene, sizing up the scene, and I'm looking for any hazardous or dangerous things in my environment. So I'll look around and make sure everything's safe for me and my patient. And while I'm approaching the scene, I'm wearing personal protective equipment and making sure he's okay. Are you okay? Are you okay? Now we're going to check for the responsiveness level and unconsciousness level. Assuming they're unconscious and they're rolled over, we want to roll the patient onto their back, flat, supporting their neck, back, and spine. And if you haven't already, and we're assuming that he's unconscious and it's life-threatening conditions, we go ahead and call advanced medical personnel. And also while we're doing that, we're gonna have to make sure his breathing, circulation, airway is open. So we're gonna do the head tilt and chin lift. So we tilt the head, lifting the chin. And also while we're doing this, we're gonna check for his pulse and see if he's breathing by feeling, hearing, and seeing. So we put our head here, 2 fingers from the chin to the Adam's apple, close to feel his pulse. My ear is gonna be nearby his mouth and nose to feel. And I'm seeing his chest to see if he's breathing. And I'm counting down. 1, 2, 5, 6, 7. And after that, you want to make sure you record your breaths per minute and make sure he's breathing as he is right now. Primary assessment, we're going to go on to doing secondary and history recording. Now we're going to perform a secondary assessment with history, but before we do a physical examination, we have to get enough information from the patient and also enough information for us. Right now we're going to do a sample history of the patient. We're going to ask various questions about the patient's history medically. So some examples could be signs, asking them about signs of pain, allergies, what kind of medications they take, permanent medical history, last time they ate or drank anything, and the events that led up to the scene. Now we're going to perform some trauma rapid assessment, which is to assess head to toe for the patient's level of pain, and if any, and by obtaining and recording a complete set of baseline vital signs. To evaluate the pain, we're going to use OPQRST, meaning onset, provoke, quality, region, severity, and time. Some questions may be, do you remember the pain where it started, before and after?
No.
Is there anything that makes the pain feel better or worse?
No.
What kind of pain is it? Dull or sharp?
Sharp.
Is that the only spot that hurts?
Yes.
Okay. On a scale of 1 to 10, 10 being the worst, what would you rate yourself?
8.
An 8? Okay. How long since the incident?
I don't know, it was all blur, maybe like 15, 20 minutes ago.
Okay. Now we're going to see some of his vital signs, which are the major ones, which is include pulse, blood pressure, and respiratory rate. Also measuring the skin tone of his skin, his pupils, which is to go up close and look at his pupils with the little scope, and which I don't have, and just to see his skin color and see if he's like unresponsive as well as like his characteristic of him talking and stuff like that. The next step we're going to perform is physical detailed examination, which is DOTS, D-O-T-S, and that is deformities, open injuries, tenderness, and swelling. So starting the examination, the physical examination, we're gonna start from head to toe. Check in first his head, mouth, back, arms, legs, ankles, fingers, and then head as well, I think. Yeah. So we're gonna go start and say, does your head hurt?
No.
Does your shoulders touch it?
No.
So now I'm gonna touch your arms, but don't just relax them and tell me if they hurt or not.
No. No.
Can you do me a favor and can you wiggle your fingers and see if anything hurts? No?
No.
And when I touch this leg, does it hurt?
Yeah.
Okay. And this leg?
No.
No? No? Okay. And can you do me a favor and move your right leg and move your ankle and see if it hurts?
No.
No? Can you do the same on the other side? Okay. That's fine. So now I'm gonna check your back and just tell me, I'm gonna feel some parts of your back and tell me if they hurt or not. So lean forward. We'll start from the upper.
No.
No?
Mm-mm. No. No.
Alright. And after we do that, we inspect his physical examination. We're gonna stand by and monitor the patient every 5 minutes if he's unconscious. And if he's a lot more responsive, then we can wait a little longer. But if he's really injured and it's serious and life-threatening, we have to wait for advanced medical personnel to arrive. And that's it.